Hey, what's up, everybody? Welcome back to another episode of the Pain Sucks podcast. I'm Dr. Matt.
Dr. Justin.
It's great to see you. We're super impressed. We're actually super grateful that so many of you are downloading this. Our goal is to just create a whole bunch of content that people can share. Here's what's interesting. I know there's a lot of podcasts out there, but what we're trying to be is unique, because a lot of podcasts give information. What we want to try to do is give you things you could literally turn the phone off or your computer off and go do, go buy, go get, and start to change your life immediately. But I think we started a couple weeks ago with this idea of like, what is pain? And really the intention was to change mindset behind what pain is. And then last week we talked about the difference between acute and chronic inflammation. And like naturally what we wanted to do is continue to give really good, simple things that you could continue to do to help you get out of pain. But I want to pause this week and introduce you to something else. And we did talk about it last week because it's become so big. It's January of 2023. We're having so much freaking success with this thing. We're actually doing in-office workshops starting next week because people have so many questions because they're just confused about all the treatments versus regenerative medicine. Right. So we're going to talk about that. So I'm going to do a Q&A. I'm going to ask questions. You're going to answer them.
Okay.
I'll jump into like if we need some clarification, or you can ask back. But this is the best way that I know how to do it, because we want you to understand, literally hang up or close your laptop and go, I understand how this stuff works. Now, before we start, asterisk, we're going to use words that your government officials don't want us to use anymore because they suck at just about everything.
Bad words.
Yeah,
bad words. Every year they put out a new list of words like don't say this word.
Don't say that word. And the reason why is they know this stuff works, and we'll explain why. And they want to keep it from you. Boy, that was controversial.
Right.
Hello, FBI. Right? So they don't want us to know this stuff, because the truth of the matter is a population that's not healthy is controllable.
Correct.
But a population that owns their health is really hard to keep wraps on. Okay. So let's talk about regenerative medicine. So when I say the word regenerative medicine, Dr. Justin, what do you think?
I immediately think natural medicine, like that heals the body from the inside out. So you're talking stem cells,
right?
Like those, which is a bad word, by the way.
Bad word.
Yeah, not supposed to use the word stem.
Yeah.
But we'll go through this that and how it works. But you're talking about natural derived tissue that will regenerate the body from the inside out.
It almost sounds scientific, like sci-fi, like something we would have seen in a movie growing up, or a movie now, or something Elon Musk is working on, or something like that. But explain the difference between explain the difference between like someone coming in and getting a treatment with an ultrasound machine or an electric stim machine and regenerative medicine. They're both for pain, but what's the difference?
Correct. One is a reactive process almost. Okay. Like that. So ultrasound e-stim, like that, is designed to work on a specific problem that already has that acute or chronic inflammation in it, where we're trying to get the body to stop that inflammation process, or start to like bring blood flow and start to help that joint along some way. Okay. Whereas regenerative medicine is about repairing the actual damage that caused that injury in the first place. Okay. So it's not like, so this is a proactive versus reactive talk a lot of times like that. So we have an injury now. We can do reactive things to it. Like get the inflammation down, get those types of things, take an ibuprofen, like it's what they've always been taught to do, throw some ice on it, whatever it is, like that. Versus going, all right, now that that's gone, let's fix this thing so it never comes back again.
Correct. So take it to the next level. So I have a knee problem. Someone comes in, calls us in, knee problem, shoulder problem, one of these, and they come in and we know that a ligament's got an issue, or it's bone on bone, or cartilage is missing, or whatever. What's the ultrasound doing for that?
Right. Ultrasound is deep heat for the most part. Like it's using acoustic waves. It drives deep into a joint. It's bringing a lot of blood flow back into that joint. All right. So it's going to loosen it up like that and get that joint moving again the way it's supposed to.
It's going to help it feel better.
Correct.
But now, what is the regenerative medicine part going to do?
So with an ultrasound, so when you bring blood flow to a joint, you're bringing healing elements from the body, like what your body has available in there, like that. But the weakness part of that is that it's your own body trying to heal that, like that. So your body only has so much capability, and it depends on your health level.
Yeah.
Honestly, like if you're not in a good place in the first place, then the ability to heal that joint goes way down.
It's really hard.
It's going to take a long time.
Yeah.
Whereas regenerative medicine goes, we can actually give the body all of the building blocks that it needs, like that, and super boost that into a certain area of the body, like that, and allow it to use those tissues to regrow.
Correct. And he used the word regrow. We literally, we don't want to miss this point.
Yeah.
The attempt and the goal is that you would not just feel better, but you would repair and regrow these damaged
Regenerate,
tissues.
whatever word. Regenerate's a great word.
Tissues.
I love it.
Okay.
Because the first thing that happens let's take a chronic joint. All right.
Okay.
So we see these knee problems. For instance, knees are just easier to talk about.
Right.
Shoulders, same thing. Okay.
Yeah.
Is we see these things that rarely is it like I tripped yesterday and hurt my knee.
Right.
This is like 20 years ago I hurt my knee and it's bothered me off and on and it's more chronic now and I've got damage in there. I've got a torn meniscus and degeneration and arthritis and all those nasty words we hear.
Right.
Whenever you start pumping those types of things in there like that, we've got to get the body to regenerate. One, you've got to have new blood flow into it like that. So the first thing, like we're not talking about fluffing up joints immediately like that. You're talking about regrowing blood vessels.
Yeah.
So the body can actually access that damaged tissue.
Right.
And then you've got what's called hyaline cartilage, which is the softer version of it, like which actually grows the tissue on the end of the bone like that. So this is a process that you've got to get your body to start going back through.
I love it. Okay, so we're gonna step back. So hopefully you understand that what we're doing is not just trying to do some foo-foo thing to make it feel good. We're literally trying to give you a new body part. So let's go back and talk history. Regenerative medicine, there's no like actual date where we can go, that's when like scientists discovered this. But how long ago did the medical world and science start like working with these things?
Oh my goodness, it's been in research for years.
Probably decades.
Yes, easily. I would say late 80s, early 90s.
Right.
I don't know. This has been available overseas.
Yeah.
Like as a very viable treatment. You just had to leave the country to do it because the FDA doesn't allow us to do it here.
That's right.
Plain and simple.
Yeah.
They've been working on cancer patients with this kind of stuff for decades overseas.
Right.
Okay. So it's just now to the point where immediately when we talk, we have these talks all the day long in the office.
Yeah.
Okay, when we have these talks, the first question we get with this kind of stuff is when we say the word stem cells, they're going aborted babies.
Right.
Okay, it's a big deal. It's the first question I always get, and I assure you that that's 100% out of the question.
It's false.
That's
actually false.
It's 100% illegal.
Yeah.
In the United States, that is not allowed whatsoever.
Right.
Like that. So we walk patients through exactly where they come from.
Right.
Okay, these are products that I've used on me, that we've used on you,
that
we've used on our patients. Like we know exactly where they come from, exactly where, and we can walk them through that process on how safe it really is.
So history shows us that back, 20 years ago, there was this discovery that if we could grab very healthy stem cells, and we're going to just do the history part and then we'll do the science part, that we could put them back in the body and the body would use those to regrow itself, to repair itself, and to heal itself. Yeah. And I can tell you that I've followed this world for a long time. And for a long time, I would encourage people, 15 years ago, if you are super wealthy and you don't mind something that probably isn't going to work, give it a try.
Right.
But over the last 7 to 8 to 9 years, the history and the science has gotten good where now I tell everybody I can, they need to figure out how to make this a part of their world. Would that be a good
100%.
Summary of the history? Okay, so
100%.
been around a while. It's not brand new, but I would tell you that as of 2023, the last 5 to 7 years have been very significant when it comes to this, which is why you're not knowing about it, which is why the people coming to our workshops don't really know about it, which is why we get stupid questions, not stupid, but questions like, it's aborted fetal tissue.
They just don't know. They just don't know. So when we say we have the ability to do that, they go, no way.
Yeah.
I mean, that's their initial reaction. Is it's just a disbelief that it's even possible.
And, there's a lot of fail-safes that have been put in place to make sure that what we're doing is safe. Okay, so been around a while, guys. I want you to understand, but gotten really, really good the last handful of years, mostly for joint pain.
Correct.
But also for autoimmune disorders and all that. So let's stop there. Let's go through some science. You use the word stem cell. However, there are other avenues of regenerative medicine that people could tap into before that. So start at what's the lowest level entry point when we talk about regenerative medicine?
You're probably talking about prolotherapy or PRP, which is platelet-rich plasma.
I think people might have heard of PRP.
Correct.
But
correct. A lot of people have. I'll start with PRP.
Okay.
PRP is a blood draw. Okay, so you draw your blood like that. All the healing elements in your body, those cytokines, the plasma, like that. PRP stands for platelet-rich plasma. Like that. So you draw the blood and you spin it, and you concentrate it, and you're extracting all of the healing elements out of your own bloodstream.
Right.
Okay, that your body would already be naturally using to try to heal itself.
Correct.
Right. So you're taking a super concentrated version of that, and you put it back into some damaged tissue.
Okay.
So you're giving the body some of the elements that it needs to heal, like that, everything it has inside of it. But what you're doing is you're recreating. It's for that chronic inflammation, that chronic problem that just never gets any better. You're recreating a small injury to target your body to get the focus on that so it will concentrate on healing it.
Okay, you went kind of fast there.
Yeah.
That went really fast. So go a little bit slower through PRP.
Okay.
Because so what we're doing is we're using their own body.
Yes.
And their own blood. Now,
Yes.
again, they're coming in, we're drawing a couple tubes of blood, and then what happens?
Yep. Okay. You're extracting all the healing elements.
How do we do that?
Okay. So we're going to centrifuge it.
Oh, so it's being spun, and the blood is separated.
Yes, like that. So you take out things that you don't want in that healing process.
Go to the bottom.
With the red blood cells.
Right.
Like they're pointless in that healing
Gotcha.
process.
They fall to the bottom.
You
of
also
the
don't
tube.
want the white blood cells.
Right.
In there. Like that. So yeah, so they're heavier, so you extract it and it just
Separates.
concentrates it and all that kind of stuff. And what you're left with is the platelets, the cytokines, the plasma, all those things like that that your body actually uses to heal.
Okay. And that is then being put back in via like a syringe,
Correct.
a needle,
Correct.
into the area where the trauma is,
Yes.
and we're hoping and praying that that is now telling the body to regrow itself,
Correct.
to reheal itself.
Correct.
So it's not an ultrasound.
No, you're retargeting this.
Gotcha.
Okay.
Okay.
So it is a regenerative procedure. Okay?
Right.
It's very much designed for joints that aren't severely damaged.
Okay.
Okay. So we get this scenario a lot where patients come in with shoulder problems and
Right.
they go, I want to talk stem cells on my shoulder.
Right.
Okay? And we do the workup on them and we get them an MRI and we get them that kind of stuff, and the damage is minimal.
Right.
Okay. They just have a ton of dysfunction and a lot of pain, not a lot of damage.
Right.
Okay. That's a PRP joint.
So we're talking athletes.
Yes.
CrossFitters.
100%.
People like with acute injury that happened a few weeks ago and they can't get over
Yes.
why, or chronic, but just isn't stopping life.
Yes.
And then imaging looks good,
Yep.
and it's just the lowest level procedure. Right.
So it's not going to regrow all that tissue.
Right.
Okay. So it's designed for that joint that doesn't need that.
Right.
Okay? But we can get that thing to heal the way it's supposed to.
So we
True
actually
healing.
use something in our office that's on sort of like, we still say PRP because it's easier to say, but we're actually using, could we describe that? Because we're still talking entry level stuff.
Right. So the product that we use in place of PRP, because
By the way, we love PRP.
did it for years.
We just think we found something
did
better.
it for years.
Yeah.
Like as technology advances, you go
Right.
look.
Yeah.
The downside of PRP,
Yeah.
or the weakness of
Right.
PRP, like that, there's no adverse effects to it
Right.
whatsoever.
Right.
But the weakness on how well it's actually going to work is
How healthy
you.
I am.
Yeah. So it's you. We're basing it on your blood.
Yeah.
Okay. So if you're not a very healthy person and are struggling with a lot of healing crisis inside the body, then we're taking that blood and trying to get your body to regrow it again. Like that, you're really going to struggle with this process.
Yeah. So we've seen a lot of results with PRP, but we've also seen the downside. So we actually explain what we use instead.
So the product that we use is that we can extract those same growth factors.
The same thing.
It's the same exact growth factors that we're trying to get out of PRP. Okay, but instead of relying on your blood to do it, okay, they are taking products the same place we get stem cells from. So we're taking like umbilical cords from newborn babies, okay, and the placental tissue like that is loaded with nothing but pure growth factors, and it's pure undifferentiated stem cells. Okay, and they're making growth. They're extracting the growth factors from that tissue.
Okay.
So on any given day of the week, like if you ask me, it's like, all right, I know what I've done to my body. 3 sports in high school, college football, pro, all this kind of beat the snot out of my body all of these years and damage like that. And you look back and you go, all right, would you like your blood to be able to try to heal this at 40 years old?
Yeah.
Or would you like that newborn baby that is pure undifferentiated like that is 100% growth factors that we know exactly what's going to happen? Give me the newborn.
I like it.
Yeah.
Stop there for a second, because this is where people are like, wait, did he just say newborn baby again?
Yep.
So let's talk about, like, in particular, the fact that this has to be regulated in such a way that everybody is safe, it's completely ethical, it's all above board, and that's why we've chosen the company we use for our products. But at the same time, like, just describe what's happening, because we're about to go into the next level up, which is the stem cells,
right.
and then the one last up. So how is someone actually getting this product?
Correct. Okay. So, you know, the idea of harvesting placental tissue like that and keeping that in umbilical cords has been around for decades. Okay?
Right.
Like people have banked these to treat cancers later on.
Right.
You know, all this kind of, it's been around for a long time. Okay.
Right.
And now it's gotten so efficient. So in order to use these products, okay, and I love the company we're with because they can produce all of this. Okay.
Right.
You're talking mom and dad have to be in the program like that for 9 months.
Yeah.
All right. Like they're compensated for it. But they get screened every step of the way to make sure that those two are candidates. Okay, along the whole time. Okay, baby has to be born in a controlled cesarean environment. Okay, to the point where it is so controlled that if mom and dad are perfectly healthy and mom goes into labor, let's say tomorrow where they were supposed to have a C-section, and it's all scheduled in there. Okay, mom goes into labor and has a natural labor the night before, everybody's perfectly healthy. They are not allowed to use that tissue because it wasn't in the perfectly controlled environment.
So it makes it almost sound like these are people who have been put in these environments. They've chosen.
No, they're being compensated for this. Yeah, they're compensated.
The point is that it produces what is literally the healthiest thing that human beings
can be. Look, it's taken immediately. They are sent off to 2 independent labs like that, so you get double-blinded like batch numbers like that, so they don't know what it is, and you're getting like they're screened again for everything that you could possibly ask questions on being screened for like that. But then you're getting cell counts and live counts, and they're making sure the tissue's viable, and they're making sure that it was extracted properly, and the tissue is exactly what we want it to do. I mean, it is so controlled.
And once again, it's not mom and it's not baby; it's the umbilical tissue.
Yes.
Where now take us into the next level. What lives in that umbilical tissue that we want to get?
Right.
These growth factors there, but what else is there?
Right. So there's growth factors. There is amniotic tissue that is designed to help autoimmune conditions. Okay. The Wharton's jelly. Okay. So in the umbilical cord itself, like the gold in there is called Wharton's jelly.
Yes.
Okay. And Wharton's jelly is pure stem cells. That's what grew the baby from the beginning. Okay.
Right.
So that is nothing but pure. There's no DNA in it. Like there's pure undifferentiated stem cells in that tissue.
What is a stem cell?
Okay. So a stem cell is the basic building block of every cell in your body.
Bingo.
Plain and simple. So your body produces them. We produce stem cells. So your red blood cells live exactly 120 days. Right. So every 121 days you got new blood.
Right.
But your body produces it in the marrow of the long bones. Okay.
Right.
So it's got to have these cells that pop out, and then your body, your brain, your nervous system, and our infinite wisdom, the way we were designed, tells these cells like you're going to be a red blood cell.
Yeah.
You're going to be muscle tissue. Right. Okay. So he's working out hard. We need more muscle tissue here. Okay. We need more of this. We need more white blood cells to help the immune system. Okay. So it is a constant turnover.
And these stem cells are what controls that turnover and controls that regulation. And so in that umbilical tissue, in that Wharton's jelly, is the gold, the most pure form of telling your body how to direct itself to heal, and that's what's being extracted.
100%.
So we've got PRP at the lowest level. We're using your own body and your own blood. And by the way, as people get older, how are their stem cells or their blood growth factors?
Well, that's what I was going to go. There's technically 3 places to get stem cells from that you can regenerate a joint with. We can get it from your own marrow. Okay, so we can put you in there and take that needle that's about this long and drill into your hips and pelvis. Fairly painful. That's really painful actually. Okay, and extract your own marrow like that, and then they have to separate it out because you can't inject fat back in and all that kind of stuff, and then you can re-inject that back into a joint. That's a viable way. It does. Like I've seen it work very well.
Do that.
It's still popular. Still lots of doctors do that. My thing with that is that so the other way to get it is called brown fat stem cells. Okay, so it's a liposuction-ish procedure. It is highly dependent on your doctors, not a lab, not double-blinded, everything else like that. It's like them in the back. Like it's highly dependent on them, like looking through a microscope, being able to pick out the good ones versus the bad ones.
Correct.
I've seen it least likely way to regrow a joint. That would be my least.
Well, the other thing is there's so much trauma that goes into getting it from those 2 ways that you then put the stem cells back in, and the first thing they go to heal is the trauma from trying to get them, and then there's not much left for what you want them for. So the third way is
and as we age.
You're
right. As we age, both of those the term is potency, but our body's ability to produce stem cells goes down with age.
Right.
We produce less and less and less. That's why we don't regenerate as fast when we get older.
Right.
2, the stem cells that we do produce, lose the ability to turn into certain types of tissue.
Correct.
Okay, so you're using a very inadequate, would be a good word like that, less powerful version of a stem cell. The older you are, or the more trauma your body has been through, or those types of things, because you're relying on your body again.
Right.
Whereas, so hands down, so in like, let's say 1 cc of fluid, right? So that's kind of how they measure it. Like, so when you get an injection, they don't count cells. They say you're going to get 1 cc of fluid. That umbilical cord tissue from a newborn baby, double. Like that, what the other ones are going to have. Like that, it's just going to be double as potent. There's no latency problems in it whatsoever. Like that, there's no issues with your own body. Like it is that much more effective.
That umbilical tissue.
Yes.
Post-birth is so powerful. That's where we're getting it from.
Right.
And it seems to be
that's why we use that product.
Where everybody is getting the best results from that.
Okay,
so we have PRP at the low entry. And then the next level is to go to this umbilical tissue where there's growth factors in there.
Correct.
Now the stem cells are in there in the form of Wharton's jelly, and we can pull that out and we can use that for different joints. What would you say are really good applications of that?
The Wharton's jelly tissue is, immediately I think it's a joint or an injury problem, like it varies knees, shoulders, hips,
foot, fingers,
thumbs, big toes,
right.
Like that, those types of things where those surgeries are really miserable.
Yeah.
You know what I'm saying? Like that, so they come in and they got, like, it is a joint. Like it needs to go into an encapsulated joint so it can disperse through that joint, but it needs to stay localized. Like we're not going to run that through a bloodstream, okay? Because we don't know where it's going to go and all that kind of stuff. So that product is specifically designed for joint problems.
And specifically, I would like to say,
disc injuries,
we've noticed that this product works great in extremity joints.
Yes.
We've not seen the massive results in the spine yet.
Right.
But we can.
They've tried to put these in discs.
Yeah.
They tried to put these in
like
that. And it
just haven't got great with the spine.
The results just aren't quite
so those
there.
things. So someone comes with a knee injury, and we do our testing and our evaluation, and we look at some MRIs and some X-rays. We're probably looking at like these stem cells as their strength. We can also pair it with those growth factors at the same time to kind of supercharge it.
Yeah.
But that brings us to the next level, which is the one we really love the most. And of course, all these can be mixed and matched based on the person's need, because you also have autoimmune disorders and gut health problems and thyroid issues and all that this can help. So the next level, so you got PRP, right? Then the growth factor stuff, and then you got stem cells. What's the highest level we have right now in science?
So the physical joint pain is very easy to talk about. You rehab it, you do this, you give it what it needs to heal, you do the right things, it'll heal. You've got stem cells, whatever it is. Okay? The harder ones have always been like autoimmune type conditions. We'll talk about that.
Systemic things.
Very much whole body. Like our body's attacking
stuff. How do we treat the whole body?
So let's talk about the easy ones to talk about. Let's talk about like Crohn's.
Right.
Okay, or IBS or irritable bowel or like all these gut issues, because that it starts in the gut.
Right.
It's chronic inflammation, body's attacking itself, can't get over it.
Right.
But if your gut doesn't work, you feel it everywhere. Right. You don't sleep, you're in chronic pain, you don't feel good, you have no energy, like these people know that. Like that when you can almost see them sometimes walking in the door and you're like, you can look at them and be like, this person has this.
And we know in that moment those stem cells are probably not that option, so what do we have for them?
Immediately. So that newest product is called, it's another bad word, it's called an exosome. Okay, right.
Yeah.
So all of these tissues, by the way, the proper word is called umbilical derived.
Human-derived umbilical cord tissue.
Right. Like they lump it into one category.
Yeah.
They're not all the same. Okay?
Yeah.
So we're going to talk about an exosome, right? So you can Google exosome therapy.
Right.
And there's a lot of stuff out there on this.
Right.
Okay? Exosomes are derived from stem cells.
Right.
Okay, so that Wharton's jelly, umbilical cord tissue, like that, they're derived from that tissue with placental tissue. Okay. And what they are is they're basically human immodulators, like that. So you can run them through an IV, and you can run them through a bloodstream. Okay. And usually with an autoimmune condition, you have like damaged messenger RNA in the body. Like your body is sending bad signals to itself.
Speed up.
Yes, like it's making these damage markers that your body is chronically attacking, okay, and it just goes out of control. Like that. Exosomes run through IVs, okay, and it stops that from happening. It repairs that damaged messenger RNA like that, allows your body to calm that reaction and to actually start healing that damaged tissue from the inside out.
That inflammatory response.
Super cool.
And we can go super deep, and maybe we'll do another podcast on messenger RNA.
We can do another
buzzword right now.
Well, we need to do another one just on exosomes.
So by putting that into the bloodstream, it goes systemic, and it has the ability to just look in the entire body for these damaged, beat up areas where the body's confused and attacking itself. And it's basically like a fire department coming in, putting out that fire. But on top of putting out the fire, it's going to then stimulate that area to begin.
Right. What resets the process? So if you're dealing with like damaged markers, okay, and it heals the damaged marker. Okay? Now your body gets to function properly again, begins the healing process. Okay. So these things are so wild. When you're talking about like a fire hose, like a whole body like that, it is so hard to explain exactly what they do in the body and exactly what they're good for. Because it is literally, I mean, these aren't even my words. It is literally the greatest healing element that you could run through your bloodstream.
Correct.
So when patients are like, you think it would help this? You're like, yes. Okay, would it help this? So we've watched patients with diabetes get some vision back. Okay, we've watched burn victims regrow skin like that. Post-COVID symptoms like that. We've had doctors vaporize it or nebulize it and run it through their lung tissue and then re-x-ray them later and watch the lung tissue start to regenerate.
Correct.
One of those things like that. So patients are getting out of bed now. They don't have pains in the morning like that, and their aches are gone and they're losing weight, and it's just this whole world.
Gut health.
Yes.
Terrible gut health. Completely resolved.
All this stuff like that. So if you come in and when patients come in and they're like, I hurt here. And that's it. Like, I'm great. Like, it's just here. You're like, all right, it's probably not an option for you. Like that. But most people aren't like that. Most people are like, look, I'm tired and I'm fatigued and I'm overweight and I can't do this. And I have gut issues like that. And I've got all my joints hurt. Like, my knee's bad, but also my shoulders, my neck, and I can't sleep. And, like, it screams systemic health.
Okay, so lowest level, down here we have that PRP. Then we get into the human-derived umbilical cord tissue with all the bad words we use today. But and they do have benefits at each level that some don't offer, but here's just a couple of quick yes or no's. Can we mix and match these things based on the person's needs?
Yes, absolutely.
Okay, we're not going to get into that today. Are there certain conditions that do better with one than the other?
Absolutely, 100%.
And that's going to be based a lot on our exam and findings,
the patient and the extras. That's why the downfall to this world is it's expensive. Okay, so this is 100% one of those things where, like, our reputation is on this too. Like, because we want patients, we want them to get better. Like, 100% that is the goal. Okay, so we're not putting this stuff into somebody's body that we don't think like that is the exact right thing for them. Okay, so we've got to have the testing done and we've got to figure out exactly what that game plan is for that individual person.
The next yes or no question: can people come and do this and then disregard their lifestyle?
Absolutely not.
Absolutely not.
100%.
Do most clinics follow up with people with their lifestyle and give them all the things that they need to continue to heal afterwards?
Nope.
That's we're
6 month phone call of see ya.
So we're gonna stay on top of people. Correct. We're gonna do all that stuff. Here's my last one. Do I have to if I'm thinking about this? Do I have to be uber wealthy?
No.
Great. And then my final question is...
Used to be.
That
was the downfall.
Yeah, it was only for the ultra wealthy.
Yeah, ultra wealthy. You had to leave the country to go and do it like that. And like, I mean, it's not cheap, but don't get me wrong. But like as this becomes more mainstream technology, and we're getting more research into it. Like that, you know what I'm saying? And as it's done like that, listen, your insurance will never pay for it. It's naturally derived tissue like that. You know, that was always the big thing. It's like, well, insurance will pay. Well, insurance don't pay for anything cool. Like none of the cool stuff we do here.
They're not about you getting true.
No, it has nothing to do with it. The insurance is going to pay for you to regrow your knee. Like that, it doesn't matter like that. But as prices have come down, a lot of people. Tons of people now have access to this that have never had access to it before.
And then the last one is, do I need to be patient with something like this?
Yes.
Why?
Yes. Healing takes time.
So this isn't like a cortisone shot?
No. Okay.
Do people have results quickly?
With a cortisone shot?
No. With this stuff?
Absolutely can. We got a text last week. Like that. We did one like on a Thursday or Friday. Like that. Dosed him up really good like that. And he texted us on Monday and was like, All right.
Great.
Yeah. Is this really a placebo? Like, is it really working?
It was my.
Yeah. It's like, because I got out of bed this morning and I don't hurt at all. Like, my energy level's sky high.
Yeah.
Like,
But
it's like, no, it happens like
But the majority of people, we want them to understand that this takes time.
yeah, you're regrowing tissue.
Yeah.
Like,
So,
this is not a.
Like, we'll have people, we tell them, like, listen, we're gonna work with you, but
Yeah.
like, I mean, month 8, month 9,
Yeah.
1 year,
Okay.
15 months, that's the magic happens.
Well, that was my experience.
yeah.
Like that, like we dosed you a couple days. Everybody heals at a different rate.
Different rate.
Like, and everybody experiences that
Yeah.
at a different level. Like that. So when for instance, a couple knee surgeries and all that kind of stuff, I did stem. That's how we got into this world. Like I started doing. I looked it up and was like, this is what I want to do to my knee.
Yeah.
Don't want a knee replacement when I'm 40.
Yeah.
Okay. Done. Okay. So when we dosed my knee and all that kind of stuff, I did all the right stuff like that. But 3 months later, if you would have asked me if it would have it was working, I would have told you I didn't know.
Yeah.
Okay. And at 5 months, I was like, maybe like that. And then like month 6 and month 7, and I got to look back, like from where I was then and where I started. I was like, this is absolutely working. I can tell 100% now.
So patience is a virtue.
Yes.
Absolutely.
Yes, it is.
Okay, so let's wrap this thing up because we could do this forever and we've already gone on long enough. So hopefully people will listen at like 1.5 speed or watch this and really understand. The last thing I'll add is it's very, very you dependent. So it's not the same for everybody. Everybody's gonna be different. It does require an exam. It does require talking to somebody who's knowledgeable about the subject.
Well, don't get me wrong, we've talked people out of this.
Yeah. Oh, that's true too.
No, it's 100%.
Yeah.
They'll come in and they'll go, we want this, and we go,
no.
It's not for you.
It's not for you.
It's 100% not for you. I
It's
don't
just
think it'll
gonna be a
work like
waste
that.
of
They're like,
money.
well, we've got the money. It's like, it doesn't matter.
Yeah.
Like, this is not for you.
Right.
Or it's not the right time for you.
Right.
Like how many people have we, several who come in and they've got this thing and it's like, look, we think you should do this.
First.
We do go do this procedure, go do this, go get this rehab, go get this, then come back.
Yeah.
Okay, then we're here for you. Like that. But it's all about that person at that time.
So if you're listening to this, it does depend on talking to the right doc about this and the right practitioner. Okay, that being said, the last little thing I'll say before we sign off is that we obviously are going to do a lot more of this. Hopefully we're not in trouble for using the buzzwords.
We're not on here next week.
For those of you that are listening to this upset about the buzzwords, we had to use them so people could do their own research.
Right.
Otherwise they'd never find it.
Correct.
So do your research, look into it. Remember that it's all about getting rid of that pain, but now it's about actually repairing yourself. And so remember our slogan is pain sucks, but remember, nobody gets to tell you that you can't heal.
100%.
And there's ways for you to do that. Be blessed, everybody. See you next week.
Amen.
I think we did great on that one.